Good afternoon, everyone. This is Kristen Jandoli with Generations Health. Thank you so much for joining us today for our caregiver program, utilizing validation, therapeutic fibbing, and other strategies in dementia care, presented by the Village at Rockville. We are so grateful to have the Village at Rockville sponsoring today's program. Before we get started, there's just a few things I'd like to cover. First of all, today's program is meant for caregivers only, meaning that continuing education credits will not be available. Secondly, everyone is muted to eliminate any background noise. However, this is an interactive program and we encourage you to ask questions, answer questions, or comment on the discussion that is taking place. And you can do this by using the chat feature. As a reminder, to find the chat, scroll over the bottom of your screen. You'll see a banner that pops up, and on that is a bubble that says chat. When you click on that, the chat feature will launch and it will most likely show up on the right-hand side of your screen. When you use the chat, your questions, comments, or answers will only be seen by our presenter, the sponsoring team, and me. Again, we encourage your participation, so please use the chat with questions. Now I'd like to ask Rochelle Clark to join us to share some information with you.
Good afternoon, everyone. Thank you so much for joining us today. Can everyone see my screen? Kristen, can you give me a thumbs up if you can? All right. So we are so delighted to have you here today and really excited to have Jennifer FitzPatrick present to us on today's topic, utilizing validation, therapeutic fibbing, and other strategies in dementia care. We also are very proud of the most accolade that we received, rated number top 10 in nursing homes in Maryland for COVID-19 vaccination rates. So I wanted to share that information with you all today. My name is Rochelle Clark. I'm the admissions manager here in the health center, and I oversee admissions in assisted living memory care, as well as long-term care and short-term rehabilitation, levels for which we have availability in all levels. So let me tell you a little bit about our health services and why you should consider the Village of Rockville, either for your client, if we have any professionals on the line, or caregivers. So we are a not-for-profit. We've been serving seniors for over 130 years. We've been recognized by the U.S. News and World Report as the best nursing home in 2020-2021. And you'll find that we offer engaging physical and social activities through connected living programming. We have on-site care center with state-of-the-art wellness, and our residents have access to extra support while in their home with the help of a service called My Potential at Home. In assisted living, we offer 50 private assisted living suites, 32 are for non-memory support, while 18 are designated for our memory care. All of our rates are all inclusive of our meals, 24/7 nursing care, weekly housekeeping and utilities, and of course, staffing 24/7. In long-term care, we offer 94 all private rooms, and we even have a special neighborhood in long-term care for memory care residents as well. In rehabilitation, we offer 66 all private rooms. Our therapy is provided 5 to 7 days per week. Our average length of stay is roughly 15 to 30 days. And we are in network with Medicare, Medicaid is secondary, Blue Cross Blue Shield, Cigna, and United Healthcare. I'm happy to report that when it comes to our vaccination rates, our team members are at a 91% vaccination rate. And skilled nursing, that fluctuates weekly or per day as we admit from post-hospital acute stays. That's a 96%, assisted living 99%, and independent living 96%. As far as our visitation, We are open daily for visitors between 10 a.m. and 7 p.m. There are guidelines in place where we require proof of vaccination. If not, if no proof is provided, we do ask for a negative COVID test within the last 7 days prior to entry. With all that being said, if you have any questions about any of our programs, the levels of care, or have a client in mind or your loved one seeking information, please do reach out to me. I can be reached and I can give you that number at 301-354-8442. And my email, I can drop that in the chat. Back to you, Kristen.
Thank you, Rochelle, for that introduction, and thank you again to the Village at Rockville for sponsoring our caregiver program today. Now I'd like to ask you a few questions. Do you want to find better ways to communicate with your loved one who has dementia? If so, you're in the right place. Our presenter is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University Certificate on Aging program. A popular media expert, she has been featured on HLN, ABC, CBS, Fox News, NBC, and Sirius XM. When she's not working, she can be found practicing her below average yoga skills. Please join me in welcoming, from Kent Island, Maryland, Jennifer FitzPatrick.
Well, hello, caregivers. I'm so thrilled to be here with you all today. As Kristen said, please feel free to write in any comments or any questions. We want you to get the most that you possibly can out of this program on how to help your loved one, how to stay sane caring for a loved one who has dementia. So today, our topic is, what strategies can you use to communicate, to take care of your loved one so they're happy and you're happy too? I'm a big proponent of family caregivers knowing that they have a lot of options. And this program, the title talks a little bit about therapeutic fibbing and validating, but there are a lot of different ways that we can be in the moment with our loved one. And I think it's so important for all of us to have lots of strategies up our sleeves. Because if you've been a family caregiver for a loved one with dementia for any length of time, you know that what worked yesterday may not work tomorrow. So it's important to refresh your skills periodically. So let's talk a little bit about therapeutic fibbing. What does therapeutic fibbing really mean? So therapeutic fibbing would be, it's controversial. Some people absolutely don't believe in it. In fact, there have been persons who have dementia who have written about this and said, please never lie to me. But therapeutic fibbing is used by professionals and family caregivers alike. And it might go something along these lines. And some of you may have done this, and feel free to share and let us know if you have. But what's for dinner? And maybe you just had dinner with your loved one. And maybe you say, we're going to have pasta. We're going to have spaghetti for dinner. And you know that they already ate. They forget that they ate because their short-term memory has been so negatively impacted. And so you decide, I'm just going to go ahead and use a therapeutic fib. They asked what was for dinner, and I just told them one of their favorite foods. And a lot of people feel very comfortable doing that. Others don't. And it's okay if you choose to use this sometimes, but if you choose not to, that's also fine. Therapeutic fibs are really considered to be a white lie, and a lot of professionals really feel that it should be used as a last resort. It is not the same as validation, which we'll talk about in a few moments. That was formulated and created by Naomi Feil. You may have read some of her books, they're very good, or taken some of her trainings. But we'll talk a little bit about that, but it's very different from that. And we'll talk about those differences in a little while. But what I want everybody to be really mindful of, if you use a therapeutic fib, I want you to be really careful about the context and the way that you're using the therapeutic fib. So let me give you an example. If I'm sitting with my spouse who has Alzheimer's and he says, when is my father going to visit? And I know that his father has passed away for a really long, has been passed for a long time. I think it's really critical for me not to give him the idea that his father will be coming by. So what we've seen families and what we've seen actually professionals do is they might say, well, when's my dad coming? Dad's been gone a while. And they say, oh, well, he'll be here tomorrow. The tricky issue with Alzheimer's and other types of dementia is while the short-term memory is so negatively impacted, there are moments when the person actually does remember. So if your loved one is thinking about his dad and he's asking, it is very possible tomorrow, he's going to say, you said my dad was coming tomorrow. So I want to encourage everybody, if you are using therapeutic fibs, and feel free, again, if you have questions about this, or if you want to share your examples, if you are using a therapeutic fib sometimes, I don't want you to feel bad about it, but I also want you to make sure that the harm is not outweighing the benefit. So there are some ways that you might be able to pivot a little bit and maybe get into being more validating, which we'll talk about very, very shortly. Reality orientation. What is reality orientation? So reality orientation might be that your husband says, where's my dad? I want to talk to my dad. When will he be coming? And we say, oh, sweetheart, I'm so sorry, but you know that your dad died. Your dad died 35 years ago. Your dad died when you were in your 30s. What we see so frequently in those cases is a trauma response, is that your loved one is going to express shock. They're going to maybe be grief-stricken, maybe cry, maybe want to talk about when's the funeral, what happened to my father, did he get hurt, is he sick? So they might have a lot of questions, or they might become very, very, very upset. And so reality orientation in that way is probably not a great idea most of the time. Now, there are times when using the really cold, hard truth can be to your benefit and to your loved one's benefit. Now, how does that work? How does that work? Well, let's talk about the stages of Alzheimer's disease and other types of dementia. So whether your loved one has Alzheimer's, whether your loved one has Lewy body, frontotemporal vascular dementia, it is going to be a progressive condition that gets worse over time. And so I liken the stages and the phases of dementia, and let's use Alzheimer's because it's the most common one as an example, of early, middle, and late. And in Cruising Through Caregiving, I talk about the concept of the early stages being much like an American visiting Ireland with no preparation. I pick you up today and I drive you to the airport, and you're going to Shannon Airport in Ireland, and you get there and you haven't prepared at all. You didn't look up what the weather's going to be like. You didn't look up any restaurants, or you just get on a plane and you go. But here's the great news. When you get to Ireland, you're probably going to do okay because they speak English. A lot of the food is going to look familiar. Now, sure, there are some differences. They drink more Guinness probably than most of us. They have a brogue, a lot of people that live in Ireland, but it really is going to be okay. You're going to be able to navigate just fine. And I liken the early stages of Alzheimer's and other types of dementia much to the way that we interact with that person. So in the early stages, I believe when we see the person maybe is a lot like themselves most of the time, but maybe they go out for a walk after dinner and they can't find their way back to the house. Or maybe they call you by their daughter's name rather than your name, which you're his sister. But in the early stages, that person still has a lot of moments of clarity. Their brain is not that far gone. And so sometimes it might be okay to try a little reality orientation. So if somebody that you care about is really truly in those early stages of Alzheimer's disease, and they say, "Where's my dad?" You might gently try, "Oh, dear, please, don't you remember what happened to your father? He's not with us anymore." See how that goes over. Your loved one might be able to accept it in the early stages and they say, "Yes, you're right, you're right." But once you get past the early stages, I don't believe reality orientation is good for you or for your loved one most of the time. That said, in the early stages, when your loved one is in that Ireland place, remember, if your loved one is in Ireland, try it once. If he responds to you and says, "My father is dead, what are you talking about? That didn't happen," or "You're lying," or they start to have a really strong emotional grief response, you want to pull back. "Oh, that's right. You know what? We'll give your dad a call another time. I'll look into it." You might sort of redirect or use a therapeutic fib. And we'll talk about validating in a little while, but be really mindful that reality orientation or using I call it the cold hard truth, can work in the early stages, but for a lot of past that, it's not. Try it, but be sure to course correct if your loved one doesn't take the truth well. Reality orientation past the early stages usually goes terribly wrong. Let's talk about those mid and late stages. I liken, in cruising through caregiving, I liken the mid stages very much to being like going to Italy with no preparation as an American. You get on a plane, you drop off in Rome, say you take a car service to the more rural area, Tuscany area, where very few people speak a lot of English. I know that a lot of times we Americans expect people in other countries to be speaking our language, but oftentimes, especially in rural areas, that's not the case. And if you go there unprepared and you haven't downloaded on your iPhone the app for Italian to English, and you haven't done research on the Rick Steves books for going to Italy, and you haven't looked up customs, you're going to struggle more than you would in Ireland. And that is very similar to what we see happening when you have a loved one that's in the mid stages of dementia. We see more delusions, more hallucinations, more wandering. And so in the mid stages, though, that said, even though there are some differences, the language, you're going to be okay, but it's going to take a lot of adjusting. So for one, you might, when you get over there, try to start picking up some of the Italian words. And for many of us, that'll be okay, because even if you don't understand Italian, you've probably took a Romance language in school. So you'll start to pick some up. But their body language, their facial expressions can be very similar. I know that when I was in Italy and we wanted to get our bill, we'd finished wrapping up a meal, we would just sort of write in the sky. Or when we're trying to get someone's attention, we put our hand up. Or if you have to go to the bathroom, you might say, "Where's the bath?" You're gesturing toward like that you have to use the restroom. So all of that is going to translate in Italy, but it's going to be tougher than if you went to Ireland with no prep. Again, feel free to write in with any comments and questions. And so also reality orientation is going to be tough in Italy too, if your loved one is in that phase, in that stage. The late stages, reality orientation is going to be very, very harmful most of the time. In the late stages, I liken that to visiting Yemen with no preparation. And so if you go to visit Yemen without preparing, without understanding the country, it's an undeveloped country, it's a developing nation, they only speak Arabic, the customs are very different, women's rights are very, very different there, the dress code is very different. It's very important to know a lot about that culture before you go there. And getting on an airplane and just being dropped off in Yemen would be very bad idea. Very bad idea indeed. So, in terms of the late stages of dementia, this is much like they're trying to navigate Yemen coming from the US, and maybe someone coming from Yemen trying to navigate the US. We're coming from opposite perspectives. The ability for your loved one to connect with you, the ability for you to connect with your loved one is constantly being diminished. And that when somebody is in the late stages of dementia, they probably don't have any verbal skills anymore. They might be communicating strictly by noises. And so if they pull you close to them when you come and visit in their bedroom and they pull you close, and you start to, they might point toward a glass of water or something that they're trying to communicate with you and tell you what they need. And maybe for some reason they're not allowed to have, or if they, they're pointing toward food and maybe they're going to have some medical tests and they're not allowed to have food, sharing that information with them, that reality orientation, not only will they probably not be able to respond to it, they probably aren't going to be able to understand it. So in the late stages, we really want to not consider reality orientation. Now, I know that there are a lot of family members that really dislike this. They say, my husband and I have been married for 53 years. I've never lied to my husband. I'm not going to start now. I would never lie to my father. He's the patriarch of our family. We're not saying that you have to lie, but you have to be very mindful of what you are sharing and how it's going to impact their mood. When somebody has advanced dementia, especially, moods are very contagious. If we're smiling, it's more likely that the person that we love is going to be more smiling. If we get tense and we get nervous and we're frowning and grimacing, that's going to have a reaction on that loved one. So just do the best that you can to be mindful. If somebody is saying, mom's best friend, she is in the hospital, we should tell her. Her best friend comes here all the time. Why would we not tell her? You want to think about are there going to be ramifications? Is this going to upset mom? Is she going to be worried and distraught and stressed out? Everybody gets worried when someone doesn't feel well, or everybody gets concerned about that person. But remember, when your brain is not working properly, like somebody who has dementia, their brain is not working properly. When that occurs, the response can be even more dramatic. So be really, really careful. I know a lot of us just want to be truthful, want to be honest, want to be transparent, but especially past the early stages, it really can cause more harm potentially to your loved one. And it can make your job, whether you're taking care of your loved one at home or whether you're visiting them at their senior living community, it's going to make your ability to connect with your loved one tougher. And we want to make it less stressful. So as far as reality orientation, really think hard about it. And if you do insist, I got to tell my mom that her best friend is in the hospital, do it once. If she forgets an hour later, let it go. Maybe use a different approach. If she forgets and she's very upset and she's asking a lot of questions, think about, is it more harmful to do this, or is it more beneficial to use reality orientation? And I know that this is a really tough one for a lot of people. And feel free to write in with your comments, with your questions, if you have anything that you would like to share as a result of if you made a mistake with reality orientation, or maybe you did reality orientation for quite a long time, and now suddenly you realize, gosh, it's not working for me. And I think a lot of people find that they learn more and more about, it's wonderful that you're here. This program, Rochelle and I are here. We've been working in this field for a really long time. But a lot of times talking to other family caregivers, if you go to a support group, that's where you're going to get the most benefit, to hear what other people have tried, hear about their errors, hear about their lessons. So let's talk for a few moments about redirection. Redirection might be husband's asking where dad is, and we know that dad passed away. And we say, actually, you know what? I need some help in the kitchen. Now, that can be very beneficial because we're getting your loved one engaged in an activity. And especially early and mid stages, until the person really isn't able to engage in activities like helping in the kitchen or taking a walk or doing some chair yoga or something like that, a lot of times we feel almost like we're being tricky, that, oh gosh, I didn't address where he is. And I said to him, you know what, we're going to go take a walk. So I know for a lot of us, it doesn't always feel right because we're not acknowledging the moment. Obviously, your husband's thinking about his dad. His dad is on his mind. But sometimes it can be nice to pivot and engage in an activity. And especially if you don't necessarily want to give reality orientation, which we've talked about it. And if you don't think, if that person's in the mid stages, or if you don't really know how to practice validation, or you don't really have the energy for practicing validation, which we'll talk about soon, maybe going and taking a walk together might be redirecting that person. So utilizing recreation and engagement to treat dementia is so important. And that's why communities like the Village at Rockville are so incredibly important, because they have a calendar of activities. They have art, and they have exercise, and they have socialization programs, and they have meals together. And there are wonderful ways that your loved one and their residents are engaged. Now, in the private home, I know it's very, very hard. Even if, say, you brought in a home care aide, you've got somebody in the home helping you out with your loved one who has dementia. A lot of times that person isn't necessarily getting that person with dementia engaged in activities. What do I mean when I say engage in activities? It can be something as simple as playing music that your loved one likes. Maybe your loved one really enjoys Frank Sinatra, or they really enjoy Motown, putting that kind of music on. Because what we find is focusing on negative or worrying or stressful emotions tend to come out for all of us when we're bored and we don't have a lot going on, but especially for somebody who has an advanced dementia. So your loved one may not be able to have a conversation like you used to have with them. Maybe your sister who has dementia was your closest confidant, and now you talk to her, you say, oh, how was your day? And she says, my day was curtains. And you think that doesn't make any sense. She can't engage in talking the way that you used to be able to talk to each other. Or she says, my day was flowers, or something that just doesn't make sense to you. But guess what? Your sister might be able to still garden. She might be able to watch an old movie that's in her long-term memory. She might be able to draw. She might be able to take an exercise class. She might be able to still go swimming, as long as some other people are around to make sure that she's safe. So engaging in activities that are stimulating, not something that's not too difficult, but also something that's not going to insult that person. So there's a lot of controversy. We hear a lot of controversy over baby dolls in dementia care, and different professionals have different feelings and thoughts about this, and stuffed animals. And my perspective on that, just my personal perspective, does it seem to give joy to the person who has dementia? If holding a baby doll or holding a stuffed animal makes that person feel good or comforted, then I believe that it's okay. Now, I think that there's times we certainly see that it's infantilizing, and it's not necessarily the best thing, that they should be engaged in doing something more adult, like maybe bringing a real dog or cat if they don't have allergies over, and that if that's something that he or she would enjoy. We often see a way to engage an older loved one with dementia oftentimes is with small children pets, animals. And there's so much data on animal therapy and the benefits. Again, if somebody doesn't have allergies, I actually have allergies, so I always always go to that. But the other piece of it is children, especially little kids, they're not expecting anything from your loved one. They're not expecting your loved one to engage in this deep conversation about politics or this big conversation about where somebody in the family should go to college or the baseball game, or they're not expecting that. What are they just enjoy playing. And I remember in Kimberly Williams Paisley's book, Where the Light Gets In, it's a very, very good book. I highly recommend it. Her book talks about her experience with her mother, and that when her kids, her little boys were really young, her mom had dementia, and she would sit on the floor and play with them, and that they could connect with her in a way that the adults were grieving who her mother used to be. The kids didn't remember, and the kids were just happy if she'd sit on the floor and play. And so think about, what does your loved one seem to enjoy? And here's the thing that I gotta tell you, I get it. You probably have children at home, grandchildren in your life. Maybe you have job, maybe you have volunteer work, maybe you have health issues of your own. You don't have necessarily time to put together this big calendar, but I would say just try to look for natural opportunities to alleviate boredom, because you're going to see more quote unquote behaviors when your loved one is bored. You're going to see more restlessness. You're going to see more challenges with communication. When we see somebody really focus on, give you an example, I share this a lot, a family that I worked with where the husband focused all the time on this 4th of July barbecue that he wanted to throw. And it was something in his long-term memory, but he brought it up all the time to his wife, and it was making the wife just absolutely crazy. But if he was more engaged in activities, he probably wouldn't be focusing on those sorts of items, like this 4th of July barbecue from the past. So what can you do? So once I worked with a family where there was a husband and wife, and I thought the wife handled this so beautifully. Every day they'd get up, they'd have their coffee, they'd have breakfast, and the husband had dementia. And around maybe 10:30, 11 o'clock, they would leave the house every day. And maybe they would go to Target or to a bookstore, or maybe they had medical appointments, or maybe they went and met a friend for lunch, but they got out of the house for a couple of hours, or maybe they went for a walk. They got out of the house for a couple of hours, they'd come home, they would both take a little rest, and then they'd watch a movie together, and then they would have dinner, and then they would put on music that he enjoyed listening to. They'd do a puzzle together. I'm not saying that these have to be a fancy calendar of activities that you want to do with your loved one, but look for natural ways to engage your loved one. You're going to have less trouble, and you're going to need maybe less of the reality orientation and the redirection and the therapeutic fibbing if that person that you care about is stimulated in a way that appeals to him or her. Again, feel free to write if you have any comments or questions, if you want to share your experience. Let's talk a little bit about validation. So validation, and Naomi File's website, and her book is called The Validation Breakthrough. Her website is vfvalidation.org. And it's a way of communicating with persons who are old and disoriented. And it reduces stress, enhances dignity, increases happiness. What it really is all about is being in the moment with the person who has dementia. And so going back to the example that we talked about earlier about husband is asking for his father, and father's passed away 35 years ago. Instead of lying or doing a therapeutic fib, doing that white lie and saying, oh, your dad will be here tomorrow, we really want to try to avoid that. Instead of redirecting and saying, okay, let's go for a walk, or can you help me in the kitchen? Instead of any of those strategies, talk about dad. Sounds like your dad's on your mind. Let's look at old photographs of him and his father. Be in the moment with where your loved one is. And so the example about the 4th of July party that one gentleman wanted to throw, that he was making his wife a little crazy because he kept bringing it up and repeating and repeating and repeating. What is so crucial there is, and I don't want to blame the wife because the wife was just exhausted and burnt out, but she wound up getting into sort of a power struggle with him and telling him, no, we've never had a 4th of July party. Turns out the 4th of July party used to be thrown with his first wife. So that was sort of a tough subject, but she was becoming very stressed, very agitated. And the thing that she could do, of something that would be validating in that case, would be like, oh, who are you thinking would be a good people to invite to this party? Let's talk about 4th of July in general. Instead of saying, honey, it's wintertime, it's nowhere near the 4th of July, which is what this individual would say to her husband. And that became really a power struggle in his mind, using reality orientation and telling him it's winter, look, it's snowing outside. Even if somebody who has dementia can see that it's snow, if they believe that it's the 4th of July, you're not going to be able to change their mind. You're really not going to be able to change their mind. So the validation, there's some great materials on Naomi Fowler's website. She's got some great books, and there's also classes that you can certainly take that can help you learn more about how to practice validation. It does take energy and it does take focus. So some other best practices. We never want to argue with somebody who has advanced dementia. We don't want to argue with that person. Your brain works properly. If you're caring for somebody who has dementia in your family, in your friend network, your brain works properly. And thank heavens for that. Your loved one's brain does not work properly. He or she is having major problems going on in their brain. And the tragedy there is that so often the person whose brain is working properly just wants to convince that person that they love, whose brain is not working properly, that it's not snowing. It's August, it's not snowing. Or that, no, I'm your wife, I'm not your sister. We constantly want to teach them. And think about, the person with dementia is always an adult. He or she is always a grown-up, but much of their behavior can tend to look more like a small child. And if you're with a child who is 2 years old and he or she is asking when Santa's going to come, and they say Santa's going to come today, right? And we know that it's not December yet. And we probably don't want to get into too big of an argument with them, because maybe that child is not going to understand that it's not quite time for Santa. We can try it, but they might throw a tantrum. The difference, of course, is the small child's brain is developing and it's going to become even more efficient, while the person with dementia, his or her brain is constantly regressing. So when we argue, it's just not a fair battle. We're never going to win. We're going to wind up upsetting that loved one. And one of the best things that we can do when we communicate with and spend time with our loved one who has dementia is try to be at peace. And I know it's hard. I know you're stressed, but to try to be at peace, to try to be calm, to try to be as positive as you can muster up. And I know that it's hard. And if those of you are having trouble doing that, it is time to course correct. Caregiving is never a job for one person. Whether you need to, if you go to cruisingthroughcaregiving.com, you can get all of the worksheets from the book for free, first chapter of the book for free. And there's all kinds of resources there. But if you find that you just can't resist arguing with your loved one, or you want to correct him or her all the time, you don't have the energy to try some of these strategies, you got to look at who in your friend and family network can help you. Who in your friend and family network can help you? Your faith community, your neighbors. Is it time for adult day? Is it time for senior living? like at the Village at Rockville. Give Rochelle a call. Her number and her email are in the chat section. But if you're not able to manage your emotions, it's so important to think, where am I going to get help? When do I need help right now? You want to try to read the mood and the behavior of your loved one. What kind of mood are they in? And what we see so frequently with people who have dementia is that their moods are so negatively impacted by the environment. Maybe the news is on, and I know it's hard to watch the news or any kind of news program because it's all negative. And maybe you've got the news on all day, and that's something that's impacting his or her mood. We know that we all get stressed out watching the news or listening to the news. Wouldn't it be better to maybe put on an old movie that's in his or her long-term memory? But another one to say is, maybe your loved one needs to take a shower or needs to take a bath, and maybe they don't feel good today. Is it really absolutely essential that he take a bath today? Could it be pushed back? Now, I'm not trying to say that your loved one should stop taking a shower for a month just because he or she doesn't feel like it, because we have to make sure that he or she cleans up. But it's really, we got to pick and choose our battles, and we want to look at their mood. Another important strategy, we want to include your loved one in conversations when he or she is present. So if I'm in the room with you and I, as the professional, come in and you need to talk to me about something that's going on with your loved one, and your loved one is present, we want to gesture and include, okay, Mary, we're talking about your medication. We're talking about where you're going to live. We don't want to ignore that person. Yes, they might not be able to understand every single thing that we're saying, but I'll tell you what, they will understand if they're being excluded. And it's going to create paranoia. It's going to create distress and upset. So if you have to have a private conversation, say with another family member, with a doctor, with another professional, figure out a way that your loved one is not in the room for that conversation, because it will create more problems. It's going to create more communication gaps and more distance between you and your loved one being able to connect with one another. Feel free to write in. If anybody has comments, questions, thoughts, feel free to write in. We'd love to hear what you have to say. So with your loved one, be a detective. I already talked about looking at the environment and looking at, is there noise in the room? Now, the holidays are going to be coming up pretty soon. The holidays, people are always, should I bring my mom to the big Thanksgiving dinner, for example? Or is it okay for, we have a birthday party for my mom? It's so important to be thinking about, how does she usually do with lots of people around? Are we talking 5 people or are we talking 30 people? How does she usually do? Think about the past to inform your future planning. So if your loved one is crying, if they are screaming, if they are verbally aggressive, physically aggressive, you want to try to take note. What's in the room? Who's in the room? Are there noises? Are there lights that are different? Is she in another unfamiliar location, not the home where he or she resides? Think about all of that. Is it, what time of day is it? Could it be something internally going on physically with maybe a headache, a stomach ache? We have somebody just wrote in, can you share suggestions about managing panic attacks and visual hallucinations with patients who have dementia? I would like to ask you, Debbie, to be, if you could be really specific about what do you mean? Can you give an example of what's going on with your loved one and what stage you think they're in? Do you think they're in the early, like Ireland, in the mid, like Italy, or in the late, like Yemen? So if you can give me the stage and tell me a little bit more specifics, I'd be glad to answer that question. So consider course correcting. And this is a big, important strategy. Whatever you're doing today, it might be working. Maybe you're committed to keeping your loved one at home with you, Or maybe your loved one is over at your sister's house, or heaven forbid, they live alone, which is often a very not a great idea for somebody with dementia. But if it's not working, what can you do to change and course correct? If it's working great today, that's wonderful. And maybe it'll go well for the next year, that your loved one's going to live with you. Everything's fine. You've got it under control. Maybe you got some help in the home. Maybe they're going to adult day. But I also want you to be thinking about what about in the future. And so this is why it's so important to talk to people like Rochelle, to look at the resources that are out there, talk to people in your support groups, or join a support group if you haven't already. But if you feel like you're burnout, and a question I often ask caregiving audiences is on a scale of 0 to 100, 0 being no stress and 100 being more stress than you possibly thought you could ever handle. If you're anywhere above 50, you probably want to start thinking about how do you course correct. And that might not even have anything to do specifically with your loved one, but it might be going to see a therapist for yourself. It might be carving out a half hour every day to read a book. I'm not saying that you have to spend a week at a spa, but what is something that you can do differently? So we've got somebody writing in that as an oncology social worker, you have a patient that you're starting to see for therapy, specifically anxiety, panic attacks, depression. She just shared that she has dementia. And now I wonder if these behaviors are more related to dementia than the cancer. So I wonder if you have suggestions for how I can navigate these conversations to offer support or how to manage them. I think this is a tricky one. So I was expecting it to come from a family caregiver perspective, but I would be curious and what stage. I'm guessing it's early stage but if you could share what stage it is, because that would definitely depend on how you would do. Okay, unsure. She just disclosed today. So I think it would be try to get information about where she is, when was she diagnosed, when did she begin having symptoms. So therapy can be kind of tricky with somebody who has a type of dementia. The other thing that I would suggest is it possible, does she definitely have an advanced dementia like Alzheimer's or Lewy body or frontotemporal dementia? And the reason I ask that is because sometimes medication can cause symptoms that look like dementia. Sometimes a urinary tract infection, a B12 deficiency. I mean, there's all sorts of reasons that someone could look like they have Alzheimer's, but I would like to think that since she's getting cancer treatment, that someone has screened that. But I would also be curious about that. So I would try to get more information, make sure that she actually has gone through the proper channels in terms of being actually diagnosed. What dementia was she told that she has? And is it really truly an irreversible dementia? Because that's going to impact how you're dealing with the anxiety, the panic, depression. But other than that, I would, until you get that information, and I would really try to do that as part of an assessment, a more further assessment. I think the other thing is work with what are the content of the panic attacks or the anxiety, where is the depression, like what is she focusing on? So I'm not trying to be vague with this question, but I think I definitely would want to get some more information about that. And I would say that you definitely, do what you usually would do. I mean, if you're seeing anxiety and panic attacks that you believe are related to hallucinations and delusions, then it really, it's a tough thing because if you're supposed to be her psychotherapist, if you're truly a psychotherapy, or because you said therapy, and I'm wondering if you mean cancer therapy or if you mean psychotherapy, you're gonna have to look and see, like, especially like if she has advanced Alzheimer's, for example, or mid-stage Lewy body dementia. If you're talking about psychotherapy, I think you need to really look at, will this would psychotherapy be productive? Is it going to make sense, or would some other type of treatment make more sense? So I'm not, if you want to share more information, I'm glad to continue that conversation if you share a little bit more, but it sounds like you might not know yet. So even in the 36-hour day, which is another wonderful book by Dr. Peter Rabins and Nancy Mace, one of the best practices that he and she talk about is, unless the behavior that your loved one has is dangerous, only use meds if you've tried some of these other strategies. If you've tried the redirection and you tried some validating and you've tried, but medicine, a lot of times we do a lot of medicating of people with hallucinations and delusions, and it really isn't necessarily the best thing for them. And there are black box warnings. And so, of course, you should work with your loved one's doctor, but even in Mason Rabins, and a lot of people consider the 36-hour day to be the Bible for dementia care. Medicine can be helpful and it has its place, but you also want to look at some of these behavioral techniques we're talking about. Soften, and this is a great acronym: smiling, having open posture, leaning forward towards your loved one, being mindful of his or her territory, their space. We don't want to just enter their space without permission. Make sure that they see you, make that eye contact, especially if you haven't seen them in a couple of hours or you haven't seen them in days or weeks. And nodding, all of that is very, very important in terms of communicating with your loved one who has dementia. So for more specifics on validating, vfvalidation.org, NAMI file. Ultimately, when we look at what is in the best interest of helping somebody who has dementia, if you take nothing else away from our time together, it's not correcting. Just be so careful about getting into a power struggle. You're the one with the power. Your brain works properly. Your loved one's does not. So I wish you all the least stressful caregiving experience possible. Please feel free to go to cruisingthroughcaregiving.com to get the chapters and to the first chapter and get the worksheets, and feel free to share them with other people in your family. And I'm going to turn it over to Kristen to wrap us up, and I'm going to keep that chat open if anybody has any additional comments, questions. And Kristen does have a brief, it will take you less than 1 minute to complete an evaluation about today's program. So I'm going to turn it back over to Kristen.
Thank you, Jennifer, for that very informative presentation. Thank you for Rochelle for being with us today. And thank you to the Village at Rockville for sponsoring this program. This concludes our presentation. We appreciate you being here today. Thank you again. Have a wonderful week, and we look forward to seeing you again soon. Take care.